You don't always feel it when your blood sugar is spiking. But when you start noticing numbness in your hands and feet, blurry vision, or fatigue after eating, it might be your body's way of sending a signal that you need to take a closer look. Diabetes isn't just a number on a lab report. It can affect other organs over time if not managed well. In this video, we will break it down step by step to understand how diabetes can impact your body and what signs you shouldn't ignore. The worrying part isn't a slight blood sugar spike after one meal. The real concern is when this happens over and over for months or years without you realizing it. At first, it might just be dozing off after lunch. Then you might get tired faster on a brisk walk, find it harder to read small print, feel a slight tingling in your feet, or notice a minor scratch taking longer to heal than usual. In this video, you won't just hear that diabetes causes high blood sugar. You'll understand exactly how each part of your body can be affected, from your heart, kidneys, eyes, nerves, and feet, right down to your daily energy levels. More importantly, you'll learn which signs are easily mistaken for just getting older, which ones you should track at home, and what questions you need to bring to your next doctor's appointment. Stick around until the end, because I'll give you a simple 5-point rule to check your body every day without doing anything complicated. There's a very common scenario many people over 60 find themselves in, living with diabetes for years, taking their meds regularly, checking their blood sugar occasionally, and thinking, as long as nothing hurts, I'm probably fine. Take a typical gentleman, for example. Every morning, he drinks his coffee, drives to the grocery store, and occasionally walks around the neighborhood. Because there's no obvious pain, he tells himself, my condition probably hasn't affected me that much. But during a routine checkup, the doctor starts asking closer questions about his blood pressure, kidney function, his last eye exam, and that slight tingling in his feet. That's when he realizes diabetes is so much more than just a blood sugar reading. Let's break it down simply. After you eat, the sugar from your food enters your bloodstream. Your body needs to move that sugar into your cells to create energy. Insulin is a crucial part of this process. But when your body uses insulin ineffectively or doesn't produce enough of it, sugar can stay in your bloodstream longer than it should. If this goes on for a long time, the problem isn't just a high blood sugar number. The small blood vessels and nerves throughout your body can be damaged over time. And the first place we need to pay attention to is your heart and blood vessels. Point 1, the heart and blood vessels. The real concern is that many people with diabetes only focus on their blood sugar, forgetting that their heart needs protecting too. If high blood sugar persists, especially when coupled with high blood pressure, high cholesterol, or a sedentary lifestyle, the heart and blood vessels can take on extra stress over time. You might not experience obvious chest pain or shortness of breath, but your cardiovascular risk could be quietly increasing in the background. For those in their 60s and beyond, this isn't something you should wait to address until the signs become obvious. When it comes to diabetes, many people only look at their blood sugar, completely missing a more important question: what extra stress are my heart and blood vessels under? For example, imagine someone with chronically high blood sugar who also has high blood pressure, high cholesterol, and doesn't get much exercise. Each of these factors needs attention on its own. But when they team up, your heart and blood vessels have to work under much harsher conditions. What makes many people let their guard down is that they don't have chest pain, they aren't noticeably short of breath, and they can still go about their day. But cardiovascular health doesn't always give you an easy to spot warning sign. Starting today, don't just log your blood sugar. Start logging your blood pressure too, especially on days when you feel fatigued, slightly lightheaded, winded while walking, or sluggish after a meal. At your next checkup, ask your doctor this very specific question. With my diabetes, are we looking at my heart health, blood pressure, and cholesterol together as a big picture? It's a simple question, but it helps you treat your whole body rather than just chasing a single number. So if you're living with diabetes, don't just ask, what's my blood sugar today? Ask yourself, how is my blood pressure? What about my cholesterol? Is my heart health being fully monitored? If you have a home blood pressure monitor, log your readings in a small notebook or on your phone, especially on days you feel tired, slightly dizzy, or out of breath when moving around. Bring those notes to your next appointment and talk to your doctor about your blood sugar, blood pressure, cholesterol, weight, activity levels, and current medications. A few consistently tracked numbers can help you understand your body sooner rather than waiting until the signs are obvious to start worrying. But the heart isn't the only organ that takes a hit. There's another organ working silently every day, and many people only know there's a problem when they look at their lab results. That organ is your kidneys. Point 2, the kidneys. Picture a man in his 60s who has lived with diabetes for years. He doesn't have any lower back pain, no burning when he goes to the bathroom, and no unusual sensations at all. So he always assumes my kidneys must be fine. He still drinks his morning coffee, goes to the grocery store, and does light chores around the house like usual. But during a routine checkup, his doctor looks at his lab results and mentions that his kidney function needs closer monitoring. What surprises him is that his body never gave him any clear warning signs beforehand. And this is the trap many older adults fall into. With diabetes, feeling normal doesn't always tell the whole story of what's going on inside. The reason your kidneys are so easily overlooked is simple. Many people still feel completely fine. You're going to the bathroom just like any other day. No back pain, no burning. You're still eating, walking around, and doing chores as usual. But in some cases, blood or urine tests might start showing that your kidneys need closer attention. Think of your kidneys as a very busy blood filtration system. To do that job well, they rely on lots of tiny, stable blood vessels. When your blood sugar stays high for a long time, especially if it's paired with high blood pressure, these tiny blood vessels can take a beating over time. So if you have diabetes, the question shouldn't be, do my kidneys hurt? A better question is, have I had my kidney function checked lately? At your next appointment, ask your doctor about a blood test to check your kidney function and a urine test to look for protein, especially if you haven't had one recently. When it comes to your kidneys, lab results usually tell you a lot more than how you feel day to day. At your next checkup, don't hesitate to ask your doctor, how are my kidneys doing? You can also ask about getting a blood test to evaluate your kidney function and a urine test to check for protein if it's been a while since your last one. Especially if you are dealing with both diabetes and high blood pressure, keeping an eye on your kidneys needs to be a top priority in your care plan. Don't wait until you have obvious symptoms to speak up. With your kidneys, routine labs will almost always tell you more than your daily feelings. And if your kidneys can take a silent hit, so can your eyes. A lot of people just assume their blurry vision is a normal part of getting older, but the story might not be that simple. Point 3, the eyes, blurry vision isn't always just a part of getting older. And getting a new prescription for your glasses isn't always the quick fix. If you're living with diabetes, a slight change in your eyesight could be a more significant signal than you think. Some people notice the print on their prescription bottles getting fuzzy, have a harder time reading their grocery store receipts, or find themselves holding their phones further away just to read a text. They usually think, my eyes are just getting weak because of my age. And that might be true. But if the root cause isn't just aging, are you ignoring an important warning sign? It all comes down to how your eyes are nourished. Inside your eyes, there are lots of tiny blood vessels, especially in the retina, the part that helps you process images and see clearly. When your blood sugar stays high for a long time or constantly spikes and crashes, these small blood vessels can take a toll over time. That's why for someone with diabetes, changes in vision shouldn't be so quickly dismissed as just getting older. A single day of blurry vision could be caused by many different things. But if it keeps happening, especially alongside post-meal fatigue, fluctuating blood sugar, or if it's been a while since your last eye exam, it's time to pay closer attention. Your eyes usually send signals through everyday tasks. Small print becomes harder to read, bright lights bother you more, or things just aren't as crisp as they used to be. You don't need to panic every time your vision gets a little blurry, but you shouldn't just guess what's wrong and brush it off either. If you notice blurriness, see strange spots in your vision, struggle with small print, or experience any unusual changes in your eyesight, write down when it happens, how long it lasts, and whether it's linked to your meals or your blood sugar readings. At your next appointment, ask your doctor or eye specialist about the right schedule for your eye exams. When you have diabetes, a routine eye exam isn't just about updating your glasses. It's about checking the health of those tiny blood vessels inside your eyes. And here's the thing to remember. Some changes you can actually see, like blurrier vision. But there's another part of your body that is much easier to neglect, mostly because it's hidden inside your shoes all day. That's your feet. Sometimes the warning sign doesn't start with obvious pain, but rather a slight tingling sensation or a minor scratch that you notice much later than you normally would. Point 4, nerves and feet. You wear a pair of slightly tight shoes to the grocery store. While walking, you just feel a little uncomfortable, but nothing really hurts. But that evening, when you take off your socks, you notice your heel is red or has a minor scrape. For most people, that's no big deal. But if you have diabetes, this scenario requires much more attention. The real issue isn't the pair of shoes you wore that day. The real issue is that you couldn't clearly feel the scrape happening. The worrying part is that foot problems don't always start with obvious pain. When your blood sugar stays high for a prolonged period, your nerves can be damaged over time. Some people experience numbness, tingling, a burning sensation, or simply less feeling in their feet than before. When your sensation drops, a red patch of skin, a blister, or a minor scrape can easily go unnoticed. And if it's caught late, taking care of your feet can become much more difficult. Your nerves help you feel pain, heat, cold, and pressure. That's how you know when your shoes are too tight, when a toenail is clipped too close, or when the skin on your heel starts to crack. But if you lose feeling in your feet, these subtle signals might not be as clear as they used to be. So tonight before you go to bed, take a close look at your feet. You don't need to do anything complicated. Just check the bottoms of your feet, your heels between your toes, and your toenails. Starting today, make checking your feet a small daily habit. If it's hard for you to bend over, you can use a small mirror or ask a family member to help you look. Wear properly fitting shoes, put on clean socks, and keep your feet completely dry, especially between your toes. When washing your feet, use warm water, never water that is too hot. If you notice any sores, swelling, redness, drainage, skin discoloration, increased pain, or a cut that isn't healing, contact your doctor right away. Don't try to treat deep wounds at home by yourself, and don't ignore an issue just because it doesn't hurt that much yet. But there's another side effect that's even harder to recognize because it hides in how you feel in your everyday life. Getting tired after meals, having trouble focusing, and your mind not feeling as sharp as it used to. Point 5, brain, memory, and energy. Your feet are a part of your body you can physically see and check every day. But diabetes can also affect something much harder to spot, how you actually feel throughout the day. If you often feel sluggish after meals, get easily foggy, or find it harder to concentrate than you used to, don't be so quick to chalk it up to just getting older. Many older adults don't even call it a symptom. They just say, I've been getting tired more easily lately. For example, after lunch, you only plan to sit and rest for 10 minutes, but you end up dozing off for almost an hour. In the afternoon, you read a few lines of the newspaper and struggle to stay focused. Some days you go for a walk around the neighborhood and want to turn back before you've gone very far. You might tell yourself, it's probably just my age. Age can certainly play a role. But if this feeling of fatigue, sleepiness, fogginess, or lack of focus keeps happening over and over, especially after meals, you should make a note of it rather than just brushing it off. The important question is this just normal tiredness, or is your body reacting to the shifts in your blood sugar after a meal? Your brain needs a steady supply of energy for you to think clearly, remember things, focus, and stay alert throughout the day. Glucose is a crucial energy source for your body, but the key isn't just having sugar in your blood, it's whether or not your blood sugar is kept stable. When your blood sugar spikes high, drops low, or swings erratically, some people can feel tired, sluggish, sleepy after eating, struggle to focus, or find that their mind just isn't as sharp as it used to be. This doesn't mean that every time you're tired, it's because of diabetes. Older adults can feel tired from poor sleep, an improper diet, a lack of physical activity, dehydration, medication side effects, or many other health issues. But if this feeling of fatigue, brain fog, and trouble focusing keeps happening, especially after meals, you shouldn't just guess what's wrong and ignore it. Consider it important information to track. So when you talk to your doctor, you have a clearer picture of your own body. Don't be so quick to blame yourself for getting weak, being lazy, or thinking this is just what happens when you get old. A tired body is not your fault. Sometimes it's a signal that needs to be listened to more closely. Write down the time of day you feel the most tired, after breakfast, after lunch, or in the evening. Note what you ate that day, how you slept, if you went for a walk, and what your blood sugar reading was. If you took it, these little notes can help you and your doctor understand your body much better. When you look at each sign individually, everything might seem minor. But when you put all the pieces together, you'll see that diabetes needs to be monitored as a full body picture, not just a single blood sugar number. Wrapping up, remember this 5-point rule when living with diabetes. Your heart, your kidneys, your eyes, your feet, and your brain energy. Don't just ask, what is my blood sugar today? Start asking yourself, how is my blood pressure? Is my kidney function being monitored? Have I noticed any changes in my vision? Do my feet have any scrapes or numbness? And am I feeling unusually sluggish after meals? Having diabetes doesn't mean you failed. A high reading doesn't define who you are. It's simply data information your body is sending you so you can listen sooner, track it more consistently, and get the right support when you need it. If this video helped you better understand how diabetes can affect your whole body, please share it with a loved one you care about. In our next video, we'll be talking about the diabetes signs that are most commonly overlooked by people in their 60s and beyond. Disclaimer, this video is for educational and informational purposes only. The content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider before applying any of the approaches mentioned here.